Started off with a case, 76-year-old female, community ambulator, fell at the grocery store in the parking lot, having trouble weight bearing. This case, you would obviously have a few different options potentially here. You could fix it, you could replace it, and you could either do a Hemi or a total. Here's going through these options. Going to go through, as in this talk, some important points in how to manage these patients and how to avoid potential complications. The history of femoral neck fractures obviously evolved over the past 100 years, so now we have a number of different implants that we have at our disposal, and hopefully with better outcomes. So talk about specifically the valgus impacted, screw fixation. There have been a number of trials looking at these patients. It's a pretty common thing to encounter. This is a randomized trial looking at 111 screws versus 108 Hemis. They found better function in the Hemis at 2 years with better timed up and go, and a higher reoperation rate in the patients treated with internal fixation. Another randomized trial in displaced femoral neck fractures, similar findings of a significantly higher rate of reoperation, 51% versus 4% in those treated with an arthroplasty. In a meta-analysis looking at femoral neck fractures in elderly, they found, again, a higher risk of reoperation in the Hemi group, with benefits of the fixation group of shorter OR time, less blood loss, and a shorter length of stay. So this patient got a hybrid hip replacement. We were able to restore leg length and offset immediate weight bearing and avoid future post-traumatic arthritis. So let's go on to case 2. This one's displaced. Was a community ambulator. Was trying to treat herself for 14 days at home with Tiger Balm, unsuccessfully. Eventually her husband dragged her into the emergency room, found to have this displaced femoral neck fracture and also a DVT. Let's talk a little bit more about Hemi versus total, cemented versus uncemented, and approaches.